Hi there. My name is Amie Archibald-Varley. I'm a nurse and I have my master's in women's health. I also host the podcast, The Green Nurse. I'm the CEO of Advancing Health Equity Together. And I'm also the author of The Wisdom of Nurses, a Globe and Mail and Toronto Star national best-selling book. So what are we talking about today? And I think as you probably can hear me, I have a cold. I have walking pneumonia, something that's definitely going around. But what we're talking about is polarization, and particularly polarization around healthcare and health misinformation. The term itself, misinformation, has become very polarized. And as a nurse, I've seen some of the most devastating effects ripple through COVID-19 and continuing through my practice and working as a health equity specialist. You probably know this because you're all journalists and speaking to a lot of folks who do research. Right now, 70% of Canadians go online to search for their medical and health related information. And it's been reported that most they more likely to trust the internet versus their own physicians or other healthcare providers, or even bringing that information to their care providers. The Canadian Medical Association reported in a 2024 study that showed that Canadians trust people that they know personally. So, their friends, their neighbors, and coworkers more than journalists and even more than government leaders. Not too surprising there. But again, I want to talk to you about something that is important to me, and it's the polarization that happens probably closest to home with your family, your friends, and your coworkers. Particularly in this situation, it was with me and my father-in-law. We had a great working relationship, a great, daughter and father-in-law relationship. And then the pandemic hit. He has known me for over 23 years, know that I worked as a nurse, and knowing that my work is rooted in evidence-based practice. But we have gone to the era of or the rise of I did my own research. The other piece was, particularly in healthcare, we went from banging pots and pans to yelling, abusing healthcare workers, and even seeing blockades in hospitals. And when this conversation came around that Thanksgiving dinner table, those lovely conversations about healthcare that would normally be those ones that would gross people out, it became highly polarized, highly political. And this is where that polarization happened within the family effect, which was devastating. This polarization has ripped families apart, had many folks not being able to speak about healthcare and the way that healthcare interacts with us from a political standpoint. Many of his own healthcare decisions at this point are solely based around some of the news misinformation that he's read from various different sources from the United States, as well as I would say is there was a lot of bots that were spreading misinformation about COVID-19. And again, there was definitely international interference and political interference at that time. Unfortunately, there's so much health misinformation online. And again, not only does it impact the relationships that we have with our friends and families in the way that I might have health conversations, but it also affects racialized and indigenous communities, Black communities disproportionately. Well, how do I know this? Let's take a slice of what happened with COVID-19 in just, for example, the Peel region. We saw various pockets of places with low socioeconomic income, racialized communities, folks that had had jobs that would force them to be working in factories, and we saw these people have some of the most devastating effects related to COVID-19. Again, we've seen when we're talking about health equity, we're hoping that, and the achievement is to have equity for all people having the same types of healthcare outcomes. But when we're seeing this misinformation, we're seeing that it's definitely hitting hardest some of our racialized communities. And again, this misleading health content, it can put people's lives at risk. And again, it is such a dangerous aspect where if we're not talking about healthcare, it can be truly devastating in terms of the fact that um, the information is misguided. So lastly, before I run out of time, I want to talk about the safety concerns that I have. And I cannot tell you more times that I've been told that I'm going to be strung up for Nuremberg trials or the death threats that I've read. They've been credible. And I know that racialized women tend to be targeted. So we do all have a job here and a role to play in fighting misinformation, and particularly in healthcare, it's talking about how we debunk false information. We need to use the tools that we have at hand to combat health misinformation, correct explanations, speak out against mistruths in terms of various different lies about vaccines or things causing autism. And we have a duty as healthcare providers and as the general public to speak to our communities, friends, and families at those Thanksgiving tables about health literacy. I think health literacy will be one of the most and key components and storytelling to change and transform this landscape in terms of politicization and health misinformation. Thank you.